Good afternoon and welcome to NTV at 1. It is the 21st of December 2020. My name is Zeynab Ismail and we begin here in the capital where Speaker Benson Mutura has taken over as acting governor of Nairobi with a promise of enabling a smooth transition in 60 days when a new governor is elected. Mutura has acknowledged that his new status is temporary and has assured the residents of Nairobi of efficient service delivery. Leila Mohammed has more.
Benson Mutura Kangara, do swear.
After a hiccup last week, Benson Mutura has finally taken the oath of office. Mutura takes over from Mike Sonko, who was impeached last week. He will hold office for 60 days, pending the election of a new governor. After the legal paperwork granting him the power to operate as the county's chief for the next 2 months was out of the way, Mutura is expressing gratitude, making it clear that his role is that of a caretaker.
That in the 60 days, I will be at the helm of this county. I will provide the required leadership to ensure a smooth transition. When Nairobi went to the poll in the year 2017, what they expected was service delivery. We therefore have no choice but to deliver. Today would have never occurred had we focused on service delivery.
Mutura's tenure comes in the wake of a turbulent year for the capital city, incessant leadership wrangles, resignations and resulting conflict from the introduction of the Nairobi Metropolitan Service derailing service delivery.
Impeachment, by their very nature, are acrimonious and leads to fallout. However, as I assume office, I promise to bring together all the leaders whether you supported the impeachment or not.
Thank you. Clap the hands. You're going to get the money now.
His first order of business was to sign the governor's warrant that gives the Treasury the green light to release funds to the county. Also present was NMS Director General Mohammed Badi, who has not been seeing eye to eye with the former governor. But even as Mutura keeps the seat warm for the next occupant, many have expressed their desire to replace Sonko, with reports of intense lobbying behind the scenes. Names already floated include former Starehe MP Margaret Wanjiru, politician Peter Kenneth, and former Dagoretti South MP Dennis Waweru. Others are businesswoman Agnes Kagure, former town clerk Philip Kisia and former Kiambu Governor William Kabogo. Leila Mohammed, NTV.
Well, the late Nyamira Governor John Nyagarama will be laid to rest on Thursday, the 24th of December, at his rural home in Tente Village in Nyamira County. The committee led by Kisii Governor James Ongwae, which had been set up to steer the state funeral for the late governor, has also announced that an interdenominational prayer service will be held at the Nyamira Primary School grounds on Wednesday, the 23rd of December, preceding the burial ceremony. Nyagarama succumbed to complications at the Nairobi hospital last Friday. Meanwhile, a section of leaders have faulted ODM leader Raila Odinga for calling out IEBC chairperson Wafula Chebukati over verification of referendum signatures. Nambale MP John Bunyasi Sakwa says Chebukati should be given the space to deliver on his mandate without influence or pressure from politicians.
Ukianza kumkemea referee na wewe ni mchezaji, wakati wa mpira utakapokuja kwamba kwani mnadhani yule referee anaweza kuwa na usawa? Sinawezekana kwamba anaweza gemea pande moja ama aogope ile ambayo inamkemea. We must allow Chebukati aongoze hii mambo. We must treat the matter professionally and legally, na tuache mambo ya kuwa na hasira kwenye hali wakati ambapo tungependa afanye vitu kwa njia tofauti.
Now, we will not endanger our lives. We will not undertake a suicide mission. No amount of money will bring back life to a dead doctor. Now, these are the words of Chibanzi Mwachonda, the Kenya Medical Practitioners and Dentists Union Secretary General. Well, KMPDU says the nationwide strike by doctors begins Monday midnight. The union is in Kisii this morning, where the medics had gathered to bury one of their own who succumbed to COVID-19 related complications Our very own Oko Kusa is there and we'll be joining him in just a moment to give us more on this particular strike notice. Well, away from that, we also have our Stacey Kirori, who is at the Kenyatta National Hospital and is now joining us live for more details of exactly what is happening there as well. Ngina, thank you for joining us. How is this strike likely to affect medical services in the country's largest referral hospital?
All right, thank you, Zeynab. Now, the strike is likely to affect the country's biggest national referral hospital in a number of ways, especially in terms of the quality of services being offered. But of course, it's only day one of the strike, and a number of the patients I've spoken to have said that services are relatively normal at this time in both the public and private wings. While some doctors have opted to stay on and offer services to those who are sickly, others have opted not to stay on and have opted to actually go on with the doctors' strike. Now, this is over a number of unfavorable conditions that the doctors have stated. Perhaps I can state them. These include a very low risk allowance that they have been offered by the government, lack of PPEs, and lack of a comprehensive medical cover, especially during this time of COVID-19. Just in addition to that, a number of the doctors, there have been arguments about both sides of the coin, with some saying that the doctors should indeed carry on with the doctors' strike as they have faced unfavorable working conditions as frontliners during the war against COVID-19, while others say it's inhumane and they lack basic essential services to health, especially during this time of the pandemic. Perhaps if you can see behind me, a number of the patients are actually trying to seek services, while others are trying to get access to the wards to visit their loved ones who may be ill at this time. A number of my colleagues are actually in Kisii attending the funeral of the late Dr. Stephen Mugusu, so I'm sure we'll get more information on that in our subsequent bulletins. But that is the status as of now here at KNH. Zeynab.
All right, thanks, Ngina Kirori there at the Kenyatta National Hospital. We'll be getting more details as well as she continues to stay on over there. Well, from Nairobi to Nakuru, where our correspondent Bridget Ngana is also there in Nakuru. It is one of the hardest hit by the pandemic, and we'll also be getting what is happening in Nakuru as well. But away from that, and to Eldoret with Lois Wangoi, and is also joining us live from Eldoret. Lois, what are the medics, administrators and citizens saying about the looming medical crisis over there?
Zeynab, let us start with the citizenry of this particular county. A lot of panic, a lot of anxiety following the doctors' strike onset on this particular day. When it comes to administrators and doctors, they are a bit concerned or shy to talking to us, noting that they fear discrimination later at their places of work. But just to paint for you a picture of the services the residents of Uasin Gishu will not be enjoying following the doctors' strike. Just to note, Uasin Gishu has about 6 constituencies, and who mainly the residents are in the rural areas, and you understand that private hospitals are not found within those areas. So just to say, about 90% of the population here will be disadvantaged when it comes to accessing medical health. Now, among the areas that we expect will have a bit of problems, number one is for patients and citizens or citizenry of Uasin Gishu County who suffer terminal illnesses, people living with kidney failure who require dialysis twice or thrice a week, people living with HIV/AIDS, people under the treatment and care management for cancer. All these services will not be available to them and will be disadvantaged. Another service that will be disadvantaged here is the service of child vaccinations. Remember, children here in the country go through a number of vaccinations to just ensure the quality of their health. That will not be availed because it is done mainly through our public hospitals here in this county. There is the issue of maternal health care. It will be disadvantaged if our nurses, clinical officers and now doctors will not be assisting mothers within this community. Then it means maternal health care will have some problems moving forward. And also the issue of accidents and emergencies. Granted that we are now along the festive season, and at times it comes with a bit of anxiety on our roads leading to accidents. It is expected that persons in this county who will will find themselves in one emergency or another, or even in an accident, will not be able to access these services. Now, we did a spot check around the county of Uasin Gishu, and we can report that a number of doctors have already shown up to work, as others abstained totally coming to work. But we understand those who came to work, speaking to them earlier, and they sought a lot of anonymity. They did declare that there's a lot of stigma around it, and so they just had to come to work. Now, granted that health is a devolved function here in the counties, we did expect that COG would continue pushing for negotiations with the doctors, but the latest communication coming from COG through their chair, Governor Paranya, is that some of the things doctors through KMPD are asking for can only be facilitated by the national government: a life insurance policy, a proper health cover, and also some remuneration, which would require the attention of SRC. And so at the county level, the governors here have sort of passed the ball to the Ministry of Health and the national government. For now, back to you in Nairobi, Zeynab.
All right, thanks, Lois. Now, and just to clarify this, the doctors' strike has only affected the public hospitals across the country. So far, no private hospital has been affected by this strike. And like we said, the Kenya Medical Practitioners and Dentists Union is in Kisii County this morning, where the medics have gathered to bury one of their own who succumbed to COVID-19 related complications. MAVOKO Kusa is there. Oko is joining us. What more can you tell us on the strike notice?
Well, Smitty, there's a lot I can tell you about this particular threat by doctors to go on strike. Actually, it's not a threat because the strike, according to the doctors, has already kicked off. It kicked off at midnight, that is waking up today. And of course, they say all the doctors are expected to be out of hospital as we speak. This, they said, just a short while at a Kisii hotel before they moved here at the home of the late Stephen Mogusu, one of the doctors who is said to have died out of COVID. And of course, they're also saying that actually his death embodies what the doctors are striking about, which is demanding for safety at their places of work. They're saying that this strike is no longer about pay rise or money, but saving a life, and that is why they're insisting that they'll only be going back to work after the government has met some of their demands. One of them, which is key, being improving their situations at their workplaces, that is provision of standard personal protective equipment. They're demanding that, and also two other crucial things they've pointed out is a group personal cover, life cover, and comprehensive medical cover. They're saying that they will not be stepping back into those institutions until those two covers are put in place. They're saying that the group group medical comprehensive medical cover is supposed to take care of the doctor's treatment should they contract infections during or in the course of their duties, and while the group personal life cover is supposed to take care of their compensations should one die out of infections and therefore or get infected, get a long-term infection in the course of duty, then that particular cover should be able to sort that particular medic out. So those are the demands they are putting forward. They're also asking the government to stop intimidation. They're saying that no amount of intimidation is going to bring them back to work. They're actually asking the CES for Health, that is Mutai Kagwe, not to threaten them with sacking, saying that threatening a doctor with a sack is like threatening a fish with water. And besides that, they're also saying that no court orders will make this strike stop, will not bring a doctor's life, a lost life of a doctor back, and therefore they will not bow down to any form of intimidation, and that this strike is on. They're saying that they gave the government up to 36 days after their 21-day notice expired. They added another 14-day for dialogue, but that has not yielded any fruits, and therefore they are determined to carry on with this strike until the government will come down and hear or meet some of the demands that they have put forward on the table. So that is what is happening now. As you can hear in the background, the funeral program is already underway here in Nyatieko, where the late Stephen Mogusu is supposed to be laid to rest later on today. And we have just seen the arrival of all the KPMDU of union officials who earlier on addressed journalists at a Kisi hotel arrive here to condole with the family. Back to you, Smitty.
All right, Kokusa, and to Nakuru County, where our correspondent Bridget Ngana is there. Bridget, Nakuru County is one of the hardest hit by the pandemic. What does a doctor's strike really portend, do you think?
Well, you've mentioned we're dealing with a cocktail of two things. One, a crisis in terms of the health of the county, the doctor's strike already ongoing, and also the issue of the coronavirus. But right now I can say that our efforts to get doctors from the county, right now I'm at the Nakuru Level 5 Hospital, and also the medical superintendent, has been difficult because they've been holed up in meetings, back-to-back meetings. And we've also gotten communication from the regional union representatives from KMPDU. And according to Dr. Tella, I'll just read a snippet of what they're saying, is that they're applauding the efforts done by Nakuru County in terms of the welfare of doctors, but it's talking about this implementation of CBA. Nakuru has really tried in terms of taking care of the interest of the doctors in terms of their CBA, but they're talking about their lives. This is not about their livelihoods, but their lives. And I'll just quote a statement that he's given us. He's saying that there is a comprehensive medical NHIF cover, but this cover does not cover doctors who have COVID and their families, and thus it has made doctors and their families infected and to drive for funds. And I think this is also in resonating with what is happening in Kisii County right now, the burial of the late Dr. Mogusu. And I'll also say that they are demanding a group life compensation and WIBA in Nakuru that has not yet been implemented, and they are saying that if a doctor dies, they do not get compensation. That is the family of the doctor. They're also talking about the regional mistreatment of doctors in Laikipia and Kirinyaga counties, and they are asking for that to be sorted, and that is why they are uniting with the other comrades across the country in downing their tolls. They're also calling for the Health Services Commission to be streamlined and also to have the healthcare system put in place. And these are just some of the proposals that are going on in line with what the national office, the union office for the Kenya Medical Practitioners and Dentists Board union is asking for in this national strike. But what we can give in a state or situational assessment of what is happening right now here at the Level 5 Hospital is that some doctors, out of duty or out of service to their Hippocratic oath, have come to the hospital and are already delivering medical services. And I can say even for now, the medical superintendent of this office or of this hospital, forgive me, is already in the office. Medical services are going on. They have not been really paralyzed as we expected with this national strike, but they're saying some of them are just coming in as much as they're in solidarity with the needs of all the doctors in the country. They do also know that this county is also in need of medical services, vital medical services at such a time. And also the regional commissioner, I did speak with him earlier on this morning, and he said it would rather be selfish to see the doctors going on strike at a time when we need them most. We are in the middle of a pandemic, and they should be adhering to their Hippocratic oath of protecting the lives of those people they've taken an oath to serve. So right now we can say that their meetings are ongoing, back-to-back meetings between the doctors, those who are on permanent and pensionable basis, those on contract, because we do know that since health is a devolved function, the county government also has the mandate or the right to employ some of the county hospitals to work at the public hospitals. There are 11 sub-counties in this county, and this is one of the highest level hospitals in terms of the population it treats. It's also at the Central Rift, so it covers also the neighboring counties. And so from the Rift Valley, the union is saying we need better treatment. Counties that have been flagged for poor mistreatment of doctors is Laikipia and Kirinyaga County, and they want to see better services, better attention given to their needs. They are also saying that as much as they do not want to leave their stations, it is important that to know that doctors' lives matters, and I think that is a message that is coming forward today from Nakuru County. But we're following up on the proceedings. We do hope to get to speak with the key persons in this county as far as the situation of the strike is concerned. But we do know that even going into the holiday season and period season, there are calls for people to maintain social distance, to protect themselves from the spreading coronavirus, but also to ensure that the doctors' welfare are taken care of.
All right, Bridget Sangana there from Nakuru County. And it is the situation across different parts of the country. Our correspondents and reporters will be keeping tabs of exactly what is happening with regards to the doctors' strike that has affected some of the public hospitals in the country. Well, at this point, we are going to take a short break here on NTV at 1. We still have plenty more. Stay with us.
Bila worries, Chrissy na Naivas is now on with the biggest and tastiest offers this festive season. Every day, 350 winners Kula shopping voucher worth 2,000 shillings. All you need to do is simply present your Naivas card when you shop for your chance to be one of the winners. Naivas saves you money.
Experience the all-new PesaPup app from Family Bank. Enjoy a fresh new look with simplified navigation, access instant loans, save and earn interest, pay your bills, send and receive money locally and abroad, buy airtime and so much more. Download PesaPup app and make your banking convenient, easier and faster. PesaPup ni pesa bila stress. Family Bank, with you for life. Family Bank is regulated by the Central Bank of Kenya.
Oya cheki, kuna vile sasa muziki manze, kuna vile inajipa manze, yani na cheki haimaanishi tu tunajibamba, yani very regular.
Kitu ya muhimu kwanza ni kujua hali yako ya status ya HIV.
Kwa hapa hivi tuwapeleke na Rieng, tujue venye manze tutasaidiana si kama vijana. Na kwa unaogopa kwenda pale hivi kwa clinic, unaweza pitia pale hivi kwa chemist ya mtaa, uitishe a self-test kit. Wanauza 500 bob only. Unajitestia tu mtaani, unajua hali yako.
Manze na ukiweza patikana nayo, yani uko positive manze, usiogope. Kuna madawa yani jo, kuna counseling manze, unaweza kula fit yani, alafu unaweza piga bado ma exercises kiasi hivi. Na kama nyewe manze ukiweza patikana yani hauna manze, usiasi tu unaenda kutafuta tena.
Cheki. Ukiweza abstain.
Lakini maji yakizidi unga,
wrap it before you tap it.
La bila gloves haiwezi. Rieng kujijua.
Unapoendelea kujikinga kutokana na HIV, tafadhali zingatia taratibu zote za serikali za kujikinga na virusi vya corona.
Afya bora, maisha bora. Jipime, jiinue.
This Christmas, jaza kwa sababu there's a whooping 1 million bob to be won. All you have to do ni kupiga shopping worth 1,500 and above. Na uko ndani ya draw. Chrissy, ibambe na Quickmart. Quickmart, fresh and easy.
The new Maisha Aluzinc Mabati from Maisha Mabati Limited. For the first time in Kenya, a roofing product that combines aesthetics with proven resilience. Its unique combination of aluminium and zinc gives it a 5 times longer lifespan than normal mabati, thanks to the excellent state-of-the-art mill. It has 20 years lifespan, it's easy to install, it's flexible and durable, it stands up to severe weather conditions, has good abrasion and rust resistance, it's affordable and is approved by the Kenya Bureau of Standards and is available countrywide. It can be used for all applications. Always insist on Maisha Aluzinc Mabati, a product of Maisha Mabati Rolling Mills, Ruiru.
This festive season, stand a chance to win at Westgate Shopping Mall. Spend a total of 10,000 shillings or more for an instant prize and a chance to win the grand prize of 500,000 shillings worth of Westgate shopping vouchers and many more amazing prizes, including a home makeover from Hotpoint Appliances, a set of luxury watches from the Diamond Watch Company, and a family holiday to Manyata Camp. Register and join the Westgate Shopping Mall WhatsApp on 0719 55 7775 for more information. This promotion runs until the 31st of January 2021. Terms and conditions apply.
Ruiru Mabati Factory offers best quality Mabati at the most affordable prices. We pride in our 10 years experience. Our products have 15 years warranty and are KEBS certified. We manufacture box profile, Europe tile, Jenga tile, corrugated S-profile, among others, in a wide variety of colors. Enjoy our free delivery in just 72 hours. To order, call us now on 0111 050 700. Ruiru Mabati Factory, Mali Safi kwa bei poa.
This Christmas, Quickmart wamesema wacha troli isuffocate, wacha troli ichoke. Jaza, 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 kwa sababu there's a whooping 1 million bob to be won. All you have to do ni kupiga shopping worth 1,500 and above, na uko ndani ya draw. Krisi ibambe na Quickmart. Quickmart, fresh and easy.
All right, well, thank you for staying with us. You are watching NTV at 1. Well, residents of Kajiado County who may have been injured by wildlife are to receive compensation from the Kenya Wildlife Services. Tourism and Wildlife Cabinet Secretary Najib Balala says that 17 million shillings will be disbursed to injured victims in 2 weeks' time. This is part of the government's efforts to minimize human-wildlife conflict, according to the Cabinet Secretary. Locals have been pushing for compensation and complaining of delays, despite some incurring life-altering injuries, I beg your pardon. KWS says 23 people have been killed by wildlife in Kajiado County since 2012. At least 134 others have suffered serious and life-changing injuries, while 1,000 livestock have been killed.
Human conflict will be resolved amicably. Compensations are coming through, and is something we are very happy about. And also benefits accruing from wildlife will now start going to the community.
Tumepeana fidia ya milioni 125 kwa wale wameuawa na wanyama. Tumepeana mwisho wa mwezi huu tutapeana milioni 17 kwa wale wamejeruhiwa na wanyama wa pori kwa maeneo haya ya Amboseli. Kwa hivyo serikali inapeana fidia. Pia tutatafuta mbinu yoyote ya kuwa zile corridors tunaweza kupata wafadhili, kwa sababu zisizibwe kwa mambo ya biashara nyinginezo ambazo zitapinga zile njia za ndovu na wanyama wa pori.
Machakos County Commissioner Frederick Ndunga is warning the MAVOKO sub-county security personnel against aiding deep-pocketed individuals involved in land sale fraud. At a crisis meeting in Ngelani area of Athi River, Ndunga spoke to how corrupt officers have escalated the rampant land conflicts in the recent past. Ndunga is warning that all land ownership documents presented by any land claimant must be verified as legitimate before any action is taken to curb injustices to genuine land owners. He has also decried the disregard of court orders.
Return all land parcels to their legal owners. Na hiyo ndio kazi yangu ile nitafanya pamoja na kikosi changu chote at county level and at sub-county level. Hiyo ndio itakuwa kazi yetu.
All right, and away from that to other stories making headlines in the international scene. More European countries continue to impose travel bans to and from the United Kingdom following the wild new strain of coronavirus detected there. On Sunday, London stated that the spread of the more infectious new coronavirus strain is out of control. France has altered all travel from Britain for 48 hours, including journeys related to goods transport by road, air, sea or rail. Germany will also halt all air links with the UK. Italian Health Minister Roberto Speranza has signed a decree which blocks flights from Great Britain and prohibits entry into Italy of people who have stayed there during the last 14 days. Other countries to impose bans include Belgium, which is the seat of the European Union, Ireland and Netherlands, Switzerland, Iran, Israel, Lithuania and Canada. Prime Minister Boris Johnson was to chair a crisis meeting today as a growing number of countries continue blocking travel. Well, away from that, section of leaders here in the country have faulted ODM leader Raila Odinga for calling out IEBC chairman Wafula Chebukati of a verification of referendum signatures. Nambale Member of Parliament John Sakwa says Chebukati should be given the space to deliver on his mandate without influence or pressure from politicians.
Ukianza kumkemea referee na wewe ni mchezaji, wakati wa mpira utakapokuja kwamba kwani mnadhani yule referee anaweza kuwa na usawa? Sinawezekana kwamba anaweza egemea pande moja ama aogope ile ambayo inamkemea. We must allow Chebukati aongoze hii mambo. We must treat the matter professionally and legally, na tuache mambo ya kuwa na hasira kwenye hali wakati ambapo tungependa afanye vitu kwa njia tofauti.
Well, into some sporting action now. The national Tong Ilmodo team, Jasiri, has started the Mombasa Open International Championships on a high note. Kenya bagged 11 medals on day one at the Aga Khan Academy Multi-Purpose Hall. And as our sports reporter Yoshua Makori reports from Mombasa, 10 countries are taking part in the 8th edition of the international competition.
After the first day of competition, Kenya scooped 4 gold, 4 silver and 4 bronze medals. In the junior girls forms category, Kaila Nyambura clinched gold, Catherine Myers won silver, as Precious Meyer settled for bronze. In the boys category, Jotham Banda won gold, Haruni Gatogo went home with silver and Samuel Njaga bronze. Hope Christine won gold in the under-18 girls forms category. Silver went to Nina Inan, while Lavenda Mbone won bronze.
Na hivi mnavyotuona tumepata support kubwa sana kutoka kwa serikali ya Kenya na World Tong Ilmodo Federation, na kwa sababu ya msukumo huo tumeona hakuna njia yoyote tunaweza kuangusha bendera yetu ya Tong Ilmodo na taifa, na tukasema lazima tusongeze mchezo huu mbele na kufanya mashindano haya yafane kabisa.
Master Clarence really worked very hard to convince, and finally Kenyan government could accept this Mombasa Open tournament to be held during this time.
Yoshua Makori, NTV Sport, Mombasa.
Well, away from that, United blitzed Leeds 6-2 to climb to 3rd in the English Premier League on Sunday, as Leicester City put a major dent in Tottenham's title challenge. And there was a lot of expected to provide a stern examination of United's rickety defence, but scored the earliest double in Premier League history, putting a side 2-0 up inside 3 minutes. Bruno Fernandes contributed 2 goals as Victor and Daniel James added a goal each. Liam Cooper and Stuart Dallas scored for the visitors. United, who made a stuttering start to the season, now have 26 points, 5 behind leaders Liverpool, with a game in hand. In the late kick-off, Sam Allardyce's